Hi, I'm Dr. Ardis, and this is the Dr. Ardis Show, and we're so excited that you're here. This is a special edition. And in this studio, for the first time ever, we've done this show. For the first time ever, we've invited a guest, Dr. Toni Engram. She is a biological dentist, and she's the owner of Flourish Dental Boutique here in Dallas, Texas. And we're so excited to actually give you an update on many things being discussed around the country right now in relationship to dental health, things that are being actually conversed on, lawsuits. City councils around the country are meeting to discuss taking something out of our water that might be impacting our health, particularly our dental health. But there's a lot of questions people around the world have been asking me in relationship to anesthetics being used in dental procedures, to ingredients in toothpaste. And these questions I had many years ago when I was raising my 5 children. And I took actions to actually step away from traditional dentistry and move to only working with biological dentists. And I'm sure a lot of those questions you might have now. And I brought a expert in that field here. Welcome to the show, Dr. Toni Engram. Say hi.
Hi, everybody. I'm so glad to be here. Thank you for having me.
All right. So I would like to ask you, what's the difference between a biological dentist, which you are, and traditional dentistry, which most of us are accustomed to?
Yeah. So the difference a lot of times is not in what we do, because a lot of what we do is the same. We still do cleanings and fillings and crowns and the normal dental procedures, but how we do it and the care that we take, the intentionality in the materials that we use, the methods that we use, that is where it can be very different. And so we're making sure that we're using products that are as natural and as safe as possible. And we're really taking into consideration the biological terrain. It's not just drill, fill, and bill. It's let's find a root cause to an issue, make sure that we're eliminating toxins and infections, and we're only replacing them with things that are safe and as effective as possible.
All right, so let's take a few basic topics that most people will be presented with or issues in a dental office, even if they didn't know they existed before they walked in. What about a cavity? What would be different that somebody might hear in a traditional dental office if it's identified there's a hole in a tooth called a cavity? What might be their approach versus your different and more intentional approach from a biological dentist standpoint?
Ooh, great question. I like that. So normally, in the way that I was trained is you see a cavity, you do a filling, and that's the end of it. If you could add some fluoride in there to help strengthen the tooth, then all the better, is what I was taught. As a biological dentist, if I can see a cavity really early on, before it's an actual hole, then I'm trying to reverse that cavity, to reverse the disease process first, so that hopefully we can avoid doing a filling altogether.
Hold up. All of America believes you can't reverse dental cavities. And that's what we're taught.
America
you
is
just
wrong.
Fill it with silver or something else, right? Some amalgam filling or something.
Yeah.
Wait, you can actually reverse holes or cavities in teeth?
You can reverse. So this is where it gets really nuanced.
Awesome.
So yes, if there's a large chunk missing, if there's a large amount of structure missing, you're going to need to replace that structure with something that is man-made, a filling, a crown, or whatever. But if you can catch it small, if you can catch it while it's still in the enamel, and sometimes even if it's past the enamel into that second layer of the tooth, then absolutely, you can still remineralize that and get those spots to heal.
Hold on. So what would you recommend to somebody if they had a cavity, or even they themselves at home were brushing their teeth, looked in their mouth, and they could see little bitty holes in a tooth? What would you recommend to them to start attempting to remineralize the bone or the tooth?
Well, I would say,
for example,
absolutely. I still think it takes guidance. I don't want you to do it completely on your own. Work with a biological dentist. Those are the ones who are going to help you along the process. But things that you can do, absolutely, are you can have things that contain xylitol, which is a plant-based sweetener. Xylitol can help shift the pH of the mouth. It can shift the microbiome in the mouth to create an environment where things can remineralize. And then you can have really effective ingredients in your toothpaste, like hydroxyapatite, different forms of calcium. xylitol in toothpaste that can help externally. But even more importantly, it's knowing what's going on internally. We want to create teeth that are resistant to tooth decay. And we do that by making sure our gut is healthy, that we're absorbing the nutrients that we're taking in, and that we're taking in the right nutrients too.
When it comes to dental health in children and yourself, when people are at home, your patients, are there specific ingredients in toothpaste that you, as a biological dentist, might recommend or tell people to look for in this world today of people who like to read labels and look at every ingredient?
Yeah.
Are there certain ingredients you recommend to people to stay away from or make sure is included in their toothpaste?
Yeah, so staying away, I really want people to stay away from things like fluoride that have so many toxic side effects. I want you to stay away from sulfates because those are not necessary and could be really irritating. Dyes, antimicrobial, like fake icky stuff, you don't need it. But if you can include things like xylitol, like calcium hydroxyapatite, and we can talk about the nuances around that ingredient, those are really helpful things that can do more benefits than even just your standard big brand over-the-counter toothpaste.
Quick lesson. Did you know, Dr. Toni Engram, that fluoride consumed even in water or in toothpaste, did you know it's published to have this dental side effect called dental fluorosis?
I did know that.
And do you know what that is? It's actually where fluoride destroys your enamel of your teeth. And so there's this paradox, really, where we're taught that fluoride prevents enamel decay from wiping out bacteria that might lead to that. But actually, it's published. They know this substance actually creates, as you consume it, and the loads or levels of fluoride get more in your body, it will actually destroy your enamel. Is that true, or did I make that up because I've read it over and over and over?
You did not.
In research studies.
You did not make that up. Fluoride actually changes the structure, the crystalline structure of the enamel itself. So instead of our tooth enamel, which is naturally composed of calcium hydroxyapatite crystals, those then change to fluorapatite crystals. So your tooth is chemically different when you're using fluoride.
All right, now there's an ingredient. We were talking about ingredients a second ago. And lots of people are flooding your office with calls and emails and questions about an ingredient in toothpaste lots of people want to ask about called hydroxyapatite. All right,
Yes.
Teach the audiences at home everything they need to know about hydroxyapatite and whether or not they should be concerned.
So there's a ton of stuff out there, and I'll put a ton of stuff on my platforms too, because we probably don't have time to cover all of it. But hydroxyapatite is what our tooth enamel is made out of. It is a natural substance in our bodies. There are two forms that can be added to toothpaste. There is microhydroxyapatite, which is natural. It's usually beef derived. And then there is a synthetic form of hydroxyapatite that is a smaller particle, and it is nano hydroxyapatite. What's interesting, because my audience, and I know your audience too, we hear the word nano and it kind of freaks us out and makes us skeptical, which I agree. It makes me skeptical too, because I've heard a whole lot of bad, nasty stuff about nano everything over the last few years. But what I can tell you is that the nano form of hydroxyapatite is more effective at remineralizing tooth structure because it's small enough, it can get deeper into the tooth enamel to replace hydroxyapatite that's missing due to diet or imbalances or whatever. What we know, thankfully, is that Japan has been using nanoparticle hydroxyapatite for 40 years with excellent safety studies. You can't say that for fluoride. We also know that the shape matters. So these tiny nanoparticles, the companies that are manufacturing it well will create spherical and cylindrical particles that are shown not to cross the blood barrier. They are not shown to enter the epithelium. So currently the safety studies are excellent on even the nanoparticle hydroxyapatite. So for me, for my family, for my patients, I would say do your own research 100%. Make sure you're working with your own healthcare providers to make a decision. But my family, I feel completely confident in the safety of even the nanoparticle hydroxyapatite. And so I still support its being used.
Awesome. All right. So everybody out there, it is true. The reference nano or the prefix nano has become scary to a lot of people for a lot of reasons. However, on the back end of that, it's typically the prefix to the word tech, nanotech, and everybody's worried that anything that has the phrase nano attached to it believes it's some kind of horrific tech. And nano just means really, really, really small so that it can get inside your cells or get inside of your tissues to provide even benefit. And there are a lot of herbal companies, nutritional companies that are moving towards making nanoparticle sized components like glutathione and others that we have actually found are extremely absorbable by the body and utilized by the cells of the body because they're so small and can be readily absorbed into the tissues. Easier than a lot of their macro sizes or the larger sizes. So when it comes to hydroxyapatite, the nano hydroxyapatite, it's already been done in human studies and been used in countries like Japan for over 40 years. All safety studies confirm it is safe. No issues or risks. Unlike fluoride.
Risks.
No risks. None.
What other ingredient can say no found, no known risks at all? That's
not very many.
Insane. Not many.
Not very many. All right. So you mentioned fluoride earlier. Let's get to another ingredient.
Yes.
That probably before Dr. Toni was born, because she's probably 18 years old. Look at her. Mm-hmm. She doesn't really remember the time when every toothpaste had on the label, if you consume more than a pea-sized amount of this and you swallow it, make sure you call it poison control. That's what it always said on every tube when I was growing up, because I'm much older than her. So for some reason, though, that has disappeared off of all the labels of toothpaste, but that was in relationship to fluoride. If you swallowed fluoride in your toothpaste, you were told from a very young age, and I was born in 1976, I was told from the time I was born, every time I looked at it, be warned, if you swallow this, you need to call poison control because fluoride is a known poison. All right. Can you bring us up to speed on the EPA lawsuit involving fluoride in the water supply of America?
I would love to. And what's interesting is I think fluoride it's representative of just so much crap that's in our water. So I hope this is the first of many substances that they're looking at and reevaluating. I don't know if that's realistic or not, but I'm hopeful. So the EPA was sued over the safety of water fluoridation programs nationwide. It took years to get through this lawsuit. And finally, the lawsuit did come to a conclusion based on really strong evidence by the National Toxicology Program, a government-funded study that showed that there cannot be determined a level of fluoride in our water that's safe. And so the judge ruled that if you can't, with confidence, say that there is a level that's safe, then the EPA is obligated to do something about that. Now, the judge didn't say what the EPA has to do. But what we know is that now that RFK has been confirmed as HHS secretary, he is absolutely in favor of discontinuing water fluoridation nationwide. And so we don't know exactly what the results will be, but all of us in biological dentistry, all of us in the holistic world are very, very hopeful that that means that at some point within this administration, maybe we will get the fluoride out of our water.
Yeah, one of the things that the judge actually was referencing were studies that have confirmed that for certain amounts of fluoride we consume, it's been confirmed for over 2 decades now in other countries, not the United States. The United States refuses to do this research, but they have confirmed in 5 other countries, which represent billions in their populations. As fluoride is added in their water and children consume them, their overall IQs continue to drop.
Correct.
And that's what was actually referenced. And the judge, who ironically is in California, passed down this ruling that now the EPA should be looking into the known published toxic effects of fluoride and making changes and restrictions and regulations for its use in water supplies. Very good. All right, let's move on. You ready? Or is there any other updates in fluoride you'd like to give?
Ready. Let's do it.
Okay. When it comes to dental care and people going to their dentist, often there are sealants recommended to people. Mm-hmm. Can you explain when sealants are recommended traditionally?
Sealants are traditionally recommended to any child with visibly deep grooves on their molar teeth, especially their permanent molars.
Okay. So what are the different sealants? What are they using? Do you know? What are the different types of sealants they use?
It's typically similar to composite filling material. It's like a plasticky type of material. You use this little, almost like little paintbrush just to paint it and let it seep down into the grooves of the teeth. And it's designed to seal up those grooves that a toothbrush bristle is too large to reach into to remove plaque and bacteria and prevent cavities that way.
So in the use of these plastic style type of sealants, is there any BPA concerns?
Much of the sealant material on the market does contain BPAs.
And we don't like those. They're called hormone disruptors, actually. They challenge our hormone balances to be imbalanced and can create, when that happens, any scenario related to menstrual irregularities, infertility, and cancers. So ask your dentist if when they suggest sealants, if BPA toxicity is right for your child. That'd be a great question. All right, so do you do sealants on children?
Over the years in my practice, I grew to have a love-hate relationship with sealants that then just turned into a hate-hate relationship with sealants.
All right.
So I noticed even before I had transitioned my practice, as I was practicing more traditional insurance-based dentistry before I saw the light, I would see sealants and sometimes even sealants that I had placed several years earlier where there were cavities that were hiding underneath the sealants. And so that started the love-hate relationship. I did what I thought I should be doing to help protect this kid from getting cavities. And lo and behold, the sealant looked like it actually caused more of a problem than it solved, because if just the tiniest little bit chips away, then it creates more of a trap for bacteria and cavities can grow without you even knowing, even at normal checkups sometimes.
Oh, imagine sealing an infection underneath that tooth. That would be awful.
Exactly.
Yeah.
Exactly.
So aside from the sealants, will there be more sealants, you believe, being recommended to kids as fluoride's being taken out of the water? Because now people are going to have children and adults that are going to develop more cavities if fluoride's out of the water supply. Do you believe
sure. You know, as a society, we are always quick to suggest an intervention to protect the public from themselves, because the powers that be tend to think that or assume that the general public is just not smart enough to be able to prevent things on their own. So I prefer instead to empower my patients with the tools that they need, with the knowledge that they need to be able to prevent these issues without having to paint their teeth with plastic, without having to add a medication to the water supply. Because it's possible, all we need to do is just protect the teeth and make them more intrinsically resistant to cavities in the first place.
Are you a mother?
I am.
Do you have children?
I do.
You do? How many?
I have two.
Two. All right. So what are some safer methods you as a biological dentist have used with your own children or recommended to parents of children to help prevent cavities from forming in their children, if there are any? What are some recommendations or methods you educate parents on? If it's not fluoride in water and fluoride toothpaste, what do you recommend to them?
You know, I start with diet. You got to start with the most impactful first. So if we can eliminate some of those easy forms of sugar like juices, sodas, candies, things like that, that's really helpful. Obviously, we're realistic. We know that we live in a world where it's really hard to avoid those things 100% of the time. And so we have a balanced approach as long as we're adding nutritious, healthy fats and protecting the gut health, then that really will play a big role. So dietary wise, with a parent, let's just run through this. Okay, Yeah.
If a parent comes in and they're worried that there's no more fluoride in the water supply, they have learned that nano-sized hydroxyapatite is safe. and they can use that in their toothpaste, or there's alternative fluoride-free versions that you might recommend to them, or people might be considering at home. What would be a dietary first look from your vantage point as the dentist? When you're talking to the parent, what would be one of the first guidelines you would either start asking them about their child's diet, or that you would make sure and say, just make sure they avoid this or reduce this or add this in daily? What were some of those recommendations be?
It depends on the age of the child. With my teens, where the parent has much less control over what their kid is ingesting every day, then I'm asking the kid directly, okay, how much soda are you drinking? What do you drink when you're away from the house? Is it lemonade? Is it sweet tea? And if we can avoid some of those, or kind of create this little fun game where we bargain, like, okay, we know you don't want to have this much soda, but maybe you're addicted to it and you just love it. Okay, let's make a deal. For every X amount of soda that you have, you're going to have the same amount of water right after. And so we start there with our big kids and our teens.
Love it.
With little kids, where mom is controlling everything that the kid has access to most of the time, we really want to make sure that we are adding nutritious, healthy fats. So avocados, olives, real meat that's from healthy sources, that's farmed appropriately, any kind of animal fat that's clean and pure, and good healthy plant fats. That's really where we want to start focusing, is can we add those things?
Got it. So there's not a specific like Kellogg's cereal you recommend that these kids eat other than others? It's not a Pop-Tart breakfast you're recommending? These Pop-Tarts reduce cavities more than others? That's not going to come up. We're not going to get sued by Pop-Tarts, just so you know.
No.
Just a discussion. This is what most kids are eating these days.
We prefer no processed foods. If we can get them something close to like a Weston A. Price type of diet, a paleo-ish type of diet, where we're just focusing on real food, then that's going to be the most ideal and the most beneficial for their teeth.
That's awesome. I'm going to go ahead and look at the camera and tell all of you at home, there's a book called Nourishing Traditions that is like the Weston A. Price Foundation's Bible of how to either ferment your own foods, garden your own foods, all natural foods without having to consume primarily processed foods. Now, the only reason why I bring that up is there's actually a guy who was a dentist back in the 1830s, 40s, who became world famous for actually producing all whole organic vegetable-based supplements to help reverse dental problems like periodontal disease, cavities, and other issues. Back in the 1830s and 40s. Oh, sorry, I said 1800s. It's 1930s and 1940s. And his name was Dr. Royal Lee. And I've studied his work for a long time, but him and Weston A. Price actually knew each other. And I thought that was amazing that
Did they really?
At the same time period, they actually were sharing the same knowledge, which was as we move forward into artificial processing food industries and supply for the American people, we are seeing more dental issues and overall chronic health illnesses. And these two individuals set off on a path very similar, re-educating the public on whole foods, eating more natural foods and less processed, and then helping to prevent all chronic illnesses, not just dental. Absolutely. So I encourage everybody to study Weston A. Price Foundation's work. Nourishing Traditions own the book. Yep. And then Dr. Royal Lee has some incredible research that you can find. And Standard Process is the company that they created back in 1820. I keep saying 18. Back in 1929, just so you know. All right. Let's talk a little bit more about dental health in relationship to the difference between viewpoints of traditional dentistry and biological dentistry. All right. I have learned this because of my certifications and hundreds of hours in studying acupuncture, that every tooth has a direct connection to every internal organ in their body. And the health under the tooth or of the tooth has a direct correlation to chronic illnesses or symptoms that the human being can experience somewhere else in their body. Do you learn that in your studies as becoming a biological dentist or becoming certified in that type of dentistry?
I did. I was not taught that in dental school, but yes, it's a well-established Eastern medicine book of knowledge that the teeth are connected along these energetic meridians to different parts of the body. So that is part of our training in biological dentistry.
Awesome. So look in the camera and point at a tooth and say, if you know any off the top of your head, point to a tooth and just describe to the people at home This tooth has a direct connection to certain chronic illnesses of X organ. Can you do that? Throw out a few.
Prostate.
Okay.
Ovaries and testes. Breast.
Uh-huh.
Lungs and large intestine.
Very good. All right. So outside of traditional dentistry, which I do know that they are taught, there is a connection to dental health and their heart, and that's about as far as it goes, because a traditional dentist, typically they'll take your blood pressure and they want to know, do you have elevated high blood pressure? And if you do, oh no, do you also have any symptoms of an infection, fever, chills, joint pain, and that stuff in the last week? And if you do, they're going to send you home with an antibiotic and tell you to come back in a week or so, because they're worried about a condition called endocarditis, which is an infection underneath a tooth moving to the heart and making it stop, causing a heart attack, and you die within minutes. That's why they send you home. But beyond that, there's nothing else I know of that traditional dentistry knows there's a direct connection to the oral health of the human and the rest of their body. Okay, so she just named several teeth and pointed to them that have direct connections to gut health. Have you seen in your practice clinical evidence, Dr. Toni, that when you resolve an issue of a tooth, that other organ systems that create symptoms in your patient outside of what would have been considered a dental problem, did you see those resolve? And give not names of people. There's HIPAA rules still in the world, supposedly. Share with the audiences maybe a few success stories of individuals who came in with a chronic illness or diagnosis, if there are any. And when you addressed a certain tooth issue, all naturally, you saw those other symptoms resolve or improve.
Well, what's interesting is the most fun story I have is where it actually worked in reverse. Oh. So we had a dental issue. This woman had pain in her gum tissue, was always wanting laser treatments from us. And so those are non-invasive. So I would do the laser treatment for her. I couldn't see anything wrong. There was no clinical sign that she should be having this pain. Her gums looked fine, but she wanted the laser treatment, so we did it. It was non-invasive. It wasn't going to hurt anything. She would come in every few weeks to have this done. And so she was gone for a while, for several months. And the next time she came back in, she said, I was gone because I had menstrual bleeding for months and I couldn't get it to stop. My naturopath couldn't get it to stop. Turns out she had a cyst in her ovary that was huge and was causing all this bleeding. And lo and behold, when she had the cyst from her ovary removed, her gums felt better. And it was all of the teeth down here in the front that are connected energetically along the same meridian as the ovary and the reproductive organs.
That's awesome. So you saw a dental problem get healed and improve when they figured out what was wrong with an internal organ.
Yes.
All this does is substantiate for all of you at home that there is actually a connection between the oral health and your rest of your body's health.
Absolutely.
So absolutely taking an all approach to keeping the entire body as a whole healthy through diet, exercise, reducing EMF radiation exposure, grounding, sweating, doing all the things we should be doing every day anyway, can actually make an improvement, just maybe, even in your dental health. And then in reverse, do you have any scenarios like that where there was an issue or symptom, migraine, whatever, it doesn't matter, and then you cleared up a tooth issue and you saw that stuff resolve?
The thing is, those stories happen every day. So it's hard for those to really stand out in my mind. But I can typically look at a patient and I can see either hidden infections or I can see the inflammation in their gum tissue. And I just know, I know you've got this list of health issues, but I really think that once we take care of the dental stuff, you're going to feel better. And I have some patients who I'll say, I know you don't think that you feel bad, but this is one of those cases where I just know, as soon as you take care of this inflammation in your mouth, you're going to feel better and you didn't know you were feeling that bad. And that is true 90% of the time when we see those cases.
Awesome. From a biological dentist standpoint, I'm not even sure if this is any different. We know how often we're recommended in traditional dentistry to make sure we have our teeth cleaned, our checkups. How often do you recommend children and adults get seen by a biological dentist or other to actually have their teeth cleaned or their oral health checked?
I still like a very specific approach per patient. So it will usually be that average every 6 months kind of game plan. But I have some patients who are very, very healthy who I'll say, I don't need to see you unless you just want to come hang out and have coffee with me until, this time next year. And then I have some who are dealing with chronic disease that we need to work on, and we need to kind of get a rein on things. And I'll see them every 3 months, every month if we need to, every couple of weeks if we need to. So we really tailor it to the patient based on what they need.
Awesome. Is there any references or websites where people can get more information about biological dentistry and some of the principles we have introduced the audience to? Even your website. Go ahead and tell them.
Well, I would love for anybody to come to my website. That is www.flourish.dental. There's no .com at the end. And general information about biological dentistry. There are a couple organizations that are really good resources. One is the IAOMT.org, and the other is the IABDM.org. So both great organizations where we do a lot of continuing education, get together and swap stories with other biological dentists. A lot of physicians, a lot of chiropractors also come to our meetings too. And so they're both really good groups that have a lot of information for professionals and for the public.
Is there any particular dental health issues that you absolutely love and are very passionate about showing up in your office?
I really love when we can take a family where they think one family member has a problem and, oh, Johnny just has bad teeth. Why are Johnny's teeth so bad? When we can take that family and we can show them, one, it's not just Johnny's problem. This is a family infection that we need to treat as a family. And when we can change that narrative that Johnny just has bad teeth, when we can get rid of that and give parents the hope that, yes, they are meant to have a healthy mouth, they're meant to have healthy bodies, and we can get them there. Those are my favorite. So it's really those root cause, getting to the bottom of chronic disease.
Now, having known you for a few years, I actually learned this concept from you that not always is one person in a family's tooth problems. Can it be blamed on genetics? You just got bad genes. No, you actually take a whole family approach, and you can help often resolve all of the problems, regardless of their specific inherited genetics, right?
For sure.
Which is what you're referencing.
Absolutely.
And for the audiences, I'll just tell you, and Dr. Toni, in case you didn't know, there's lots of people that I would see with chronic sinus issues, reoccurring ear infections, or reoccurring respiratory infections. And each one of these people, we actually had to identify or actually evaluate the entire family and their pets to find out which one, if any of them, are actually helping to recreate and retransmit whatever it was that was going around the family. So we had to address all of their health at once to resolve the entire family's problems, because it'd be one kid, then an animal, then a parent, then a kid, and these things would just move all around, and you had to resolve them all. Yep, we were playing whack-a-mole. And so I became very good at making all the families, bringing everybody who was living and breathing in that home, and let's sure we assess all of their health and make sure that we address the underlying theme that is moving between all of them. Is that something similar to what you're talking about?
Absolutely. You just made me think of a really funny fact. Did you know, you were talking about lung issues connected to dental issues. Did you know that dirty dentures is a major cause of pneumonia acquired in hospitals?
No, but I would not doubt it.
Ew.
Gross. So ask your doctor if your dentures are clean, right? That's the thing, right? Are my dentures clean?
Yeah, just because you don't have any teeth, you still got to clean your mouth.
All right, one question, and actually I got two questions. All right, so two final questions for you, Dr. Toni.
Okay.
Number one, general health tip that you would like to give out to anybody out listening that this might benefit, or in general for all people that you would recommend you consider to improve your overall health, including dental?
A general health tip is, it's really mindset. My daughter makes fun of me and she says I just gaslight myself. But I say that believing that you have the ability, that God gave you a healthy body, and that you can have a healthy body. That is the biggest thing you can do to make sure that you have a healthy body.
Amen to that. And then Dr. Toni, next question. So mindset is key. Don't forget it. We talk about it all the time. What you believe matters and what you think. All right. Then number 2, if there was one book on earth, even unrelated to dentistry, one book you believe everybody on earth should read that's had a major impact on your life.
Ooh. Oh, you should have asked me that ahead of time. I would have thought about it. That's had a major impact on my life. I would say the Beat the Heart Attack Gene book really helped change the narrative on dentistry and the oral systemic health connection.
Awesome. Repeat the title again.
Beat the Heart Attack Gene.
Very good. I haven't read that book. I'll need to read it. All right. This is the Dr. Ardis Show, a special edition. Once again, give me your website address.
www.flourish.dental.
I'm Dr. Brian Ardis. This is Dr. Toni Engram. You know where to find us. We'll see you next week on the Dr. Ardis Show.